Our next speaker you all probably know. I have only known Twila for a little bit, but I must say that I am happy to have her in my network of strong women who how do you do everything that you do network. So I'm very excited about that. If you don't know Twila Brase, she is president and co-founder of this organization. In August of 2009, Modern Healthcare magazine named her number 75 on a list of the 100 most powerful people in healthcare. That is quite a title. Under her leadership, the Council works to protect health freedom at the state and the federal level. For example, the Council's diagram of the Obamacare exchange has been published on the homepage of a member of Congress, used by other conservative state groups, and printed in many news outlets. And the Council's discovery of the state storage and use of newborn DNA in Minnesota without parent consent has led to changes in law nationwide, as well as lawsuits in Minnesota, Texas, and Indiana. Ms. Brase has received the Freedom of Informed Consent Award at a Sacred Fire of Liberty celebration on the Chesapeake Bay, as well as the Eagle Award from Phyllis Schlafly, right? Schlafly? Yeah, we worked on this like for 20 minutes. And who's the founder of the Eagle Forum. Twila provides daily commentary on 367 stations in 41 states through the CCHF's Health Freedom Minute. She provides testimony at the Minnesota State Legislature, writes a weekly newsletter, speaks around the nation, and meets with members of Congress. In fact, her third trip to Washington, D.C. this year is next week, and she was invited out there by a member of Congress. Ms. Brase has been interviewed by CNN, Fox News, the Glenn Beck Program, MN Public Radio, NBC Nightly News, NPR, the Star Tribune, and Bloomberg News, the Wall Street Journal, and many others. She's a very busy lady. And if that wasn't enough, her article, Blame Congress for HMOs, has been placed into the Congressional Record of the U.S. House. Whew. Please join me in welcoming Twila Brase. Being here. Matt will turn this one off so I don't accidentally make more noise with it. Is it still on? No, I hear some no's. Okay, there we go. All right, well, thank you so much for coming tonight. I have one question to start out the night with. Who wants Obamacare to go? Well, it will. Just saying. Tonight, I want you to join with me to declare your independence from Obamacare. In other words, I want you to declare that you are convinced in your heart and soul that it will not be with us forever and that we will break free from Obamacare. Tonight, I'm going to share some of our successes from the past year, as well as to tell you what Citizens Council for Health Freedom has planned in order to help break free from Obamacare. Government-run healthcare is dangerous. It is moving us from patient care to paperwork. It's moving us from care to coverage, from privacy to profiling, and from the mission of medicine to the cold, calculated business of healthcare. We are moving in a direction where healthcare will not be any more about a decision between you and your doctor. It will be a decision that some outsider imposes on you. That's not the way healthcare should go. So consider a father who called our office
He has a 1-year-old with cancer. And he and his wife are frustrated. The reason they're frustrated is because the hospital refuses to do anything but what is in the computer, the standardized treatment protocol. For a little bit, the hospital said, no, we'll give you a choice. And then the hospital said, no, sorry. We're going to only do the treatment protocol. So the father said to me, I've done a lot of research. I now realize that Obamacare is part of this. But me and my wife, we don't care about policy. We care about our son. But he's stuck, and the hospital refuses to do anything. So this is where healthcare is going, to automation, to standardization, and to computerization. Clinics and hospitals that comply with the protocols embedded in the computer will be paid better than those that don't. Now, how did this happen? In one word, HIPAA. And I want you to realize that HIPAA was actually in Hillary's plan. It just took her a few years to get it to happen. So HIPAA, the Health Insurance Portability and Accountability Act, has a privacy rule that isn't a privacy rule. It opened your medical records to 2.2 million entities without your consent if they have a reason to know.
No.
Plus, yes. I thought you said no. Plus all the government agencies can also have access. So it also allowed computerization, and it allowed placing your records online on the grid. It allowed outsiders to embed treatment protocols. One doctor told me, if it's not in the computer, I can't do it. It allowed tracking of treatments, profiling of patients and doctors, and paying doctors for compliance with the protocols. Citizens Council for Health Freedom has an emphasis on privacy. And the reason is because we know that he who holds the data makes the rules. We know that the watched are never free. We know that your data will be used against you and used to control your doctor. And we know that once we have a national medical record system, we will have if we don't have it immediately, we will move to a national healthcare system. So, thus, Citizens Council for Health Freedom is very focused, like a laser, on privacy. Because that's where the control is. Obama knew it, knows it, Hillary knew it. So, I'm happy to report that we've had many wins this year because of your support. So let me just share a few of them. In Minnesota, we got an exemption to the computerized medical record mandate for practices that are solo practices and practices that are cash-based practices, no matter what size they are. Now, we can give a great deal of thanks to some people in the room for that. Representative Peggy Scott, Representative Lucero, wherever he is, and as well as Representative Gruenhagen and Representative Mack. So, we also got a bill introduced to prohibit coercive consent forms by Representative Gruenhagen. If it's enacted, you'll be able to say which of the items above your signature on this consent form you actually are willing to consent to. Right now, you basically have to consent to them all. So when you get a consent form at the hospital or the doctor's office, please ask for a copy, send it our direction, and Representative Gruenhagen and I, and maybe Representative Scott and I, will work on getting you that right to not be coerced into things that you don't want to just to get treatment. In addition, as a result of our efforts, the Minnesota Department of Health was mandated to itemize their use of a $2 million slush fund for something called reducing infant mortality by eliminating health disparities. There are no other words, to tell them what they have to do with that $2 million. They've been getting that $2 million for 10 years. But we do know that it's a central planning agenda because of a report they put out at the last minute. They want to essentially take over, they want to use it to deal with transportation and finance and housing and everything for health disparities. So we are grateful to Representative Matt Dean, who's also with us tonight, for adding the requirement that they must say what they are doing with that money. Thank you. And in Congress, we won a parent consent amendment requiring consent for federally funded use of newborn DNA. Those are the little blood spots after newborn screening. For that, we have two particular people to thank. One of them is Senator Rand Paul, who, once he found this out, put a hold on the bill and then was the person who put the amendment. But the other person that we can thank is Congresswoman Michelle Bachmann. When we saw the newborn screening bill come, we called her office. And she interrupted her schedule for the day, took a few bullet points, went on the floor of the House, gave a 3-minute speech on privacy that was really brilliant. It caught the attention of the Senate, and now we have a law. Thank you. In addition, we have published 2 reports, one about surveillance by the states through the birth certificate process, surveillance on families, and another one on the HIPAA privacy deception, including 12 personal stories from individuals who have chosen not to sign the HIPAA privacy form. We have a special campaign for that, and you can find it on our table out there. By signing, some of them weren't allowed by not signing, some of them were not allowed access to care, even though the law does not require them to do this. But for our perspective, we are trying to get out the word that HIPAA has nothing to do with privacy whatsoever. It actually took away your privacy. So all of this is because of you, including the radio stations, 367 radio stations that get the Health Freedom Minute. And I want to just say about the radio stations that this is the way that we change hearts and minds. This is the way that we let people understand healthcare. I asked a woman recently, I said, so what do you like about the Minute? She said, well, I know that it's 1 minute that I should stop and listen because I'm going to learn something. And it's not so long that my eyes glaze over. So this is all because of you. Thank you so much for your support. We cannot be at the legislature. We cannot do this without all of you. Now, when Martin Kellogg and I started this organization, we understood that if government took over healthcare, it would take over you. It would take over the country. And so we realized that freedom would be gone, privacy would be gone, patient choice would be gone, ethics would be gone, compassion, charity, everything would be gone because the government would be in control. Gone, gone, gone. Speaking of gone, I recently talked to a nurse who has practiced for 42 years, and I said to her, so what's the biggest change in 42 years? And she said without hesitation, the chart. I said, oh, the computerized medical record. That was not a surprise. But then she said, all the joy is gone. They have taken the heart out of healthcare. The heart. Well, as a nurse, okay, drink of water or something, right? Okay. As a nurse, if I take the heart out of a patient, what do I have?
A dead body.
A dead patient. That's right. And that's exactly what the computerized medical record is doing to healthcare. So it is no coincidence that the Obamacare implementation date and the computerized medical record implementation date were exactly the same, January 1st, 2014. Because those who want to control healthcare realize that they can't allow us to have privacy. They have to get into the exam room. They have to know what the doctor's doing and control it. So one thing that we would like to do next year with your support, we hopefully will be able to do this, is you may recall that we had the Obamacare games billboard. It said, refuse to enroll. And that billboard went viral. It was in 5 states. People were taking pictures of it in Nashville and in Denver and Houston. And then they were Facebooking it and tweeting it. And the funny thing is that was February, March of 2014. Well, this February, March, somebody took that picture again and put it on Facebook, and it went viral again. So, the wonderful thing about social media is you can have, like 5 billboards like we had in 5 states, but then it goes everywhere in a picture. So with HIPAA, everybody thinks that HIPAA protects privacy. Just ask Matt sometime. Matt and I were in Washington, D.C. talking to legislators and their staff. To a person, when we said, what does it mean when you sign that HIPAA privacy form? To a person, they said, it means my information is protected. Protected. 2.2 million entities, according to a federal rule, can have access if they have a right to know without your consent. So we would like to do a billboard, something like maybe HIPAA is a lie, right? No privacy in here. So Citizens Council for Health Freedom is committed to the repeal of Obamacare. We're committed to stopping it all the way to repeal. So when you think about breaking free from Obamacare, I want you to feel the hope and the excitement that I feel. As a matter of fact, what if the next president could allow us to break free from Obamacare without Congress? Have you ever thought that that might be possible? No. Mm-hmm. Well, we believe he or she can. So if our next president is committed to freedom, committed to getting rid of Obamacare, Citizens Council for Health Freedom has a list of ideas. So let me share a few. The first thing, day 1, delete the connection between Medicare and Social Security. Some of you probably don't know what this connection is. Some of you do. Medicare Part A, if you get out of Medicare Part A or you refuse it, you lose your Social Security payments that you've gotten all your working lives that have been taken out of your checks. Why? Not a law, not a rule. Some bureaucrat wrote it in a booklet, and that's what they followed. In an instant, the president could say, out of here. And then, how many people would choose to be free from Medicare? That's the beginning. The beginning of government-run healthcare was Medicare. That can be the beginning of the end of government-run healthcare. So the second thing that the president can do is put a warning on healthcare.gov. And I figured this warning might look something like this. If you go on this website, security experts have said your data is not secure. But if you choose to put your data into this website, the federal government will keep it forever, even if you don't enroll. And then, if you do get money as a result of going on this website, but you don't tell us that you get a better job or your income goes up, the IRS will come knocking on your door and take it back. Happy shopping. The president could also shut down the state and federal exchanges for lack of data security. 3 people testified and said it should be shut down because there is no security. The next president could strengthen and showcase the 14th hardship waiver. How many of you even know what the 14th hardship waiver is? Obama actually did this, but doesn't showcase it. It says if for any reason you find getting coverage to be a hardship, just let us know. You don't even have to provide documentation. And a lot of people don't even know that. But the next president could make sure everybody knows that, and therefore undercut Obamacare. The next president could reinstate the freedom of conscience rule for doctors and nurses, and he or she could exploit the flexibility in Obamacare. You probably don't know this, but oftentimes what the law says is this and that organization or whatever shall do thus and so, A, B, C, D, E, and at the very end they'll say, and anything else the secretary requires. It's an open door. Imagine what the president could decide that the secretary had to require to make health plans and others not want to have anything to do with Obamacare. And finally, the president could rescind HIPAA or require patient consent as a matter of the Fourth Amendment. And the reason that the president can do all of this is because essentially Congress has ceded their authority to regulators. So the regulators are all under the executive branch. And this is the exact power that Obama has been using. So no doubt these would cause havoc, but no more havoc than Obama has already created using the same administrative power. And this time it would be in the right direction. So the last thing that we need is peaceful acquiescence to the federal takeover of healthcare. I agree with Ginny Thomas when she says that we need to be troublemakers for liberty. But what if we don't get a president committed to breaking free from Obamacare? And what if Congress refuses to repeal Obamacare? Are we stuck? No. We're America. We're never stuck. Citizens Council for Healthcare has a very, oh, that's so funny, I went back to our old name. Citizens Council for Health Freedom has a very big plan. It's unique, it's unusual, we're going to need your help. In this plan, what's going to happen is we will go back to pocketbook-friendly, patient-friendly, privacy-friendly healthcare. So just imagine with me a new way of doing healthcare in America. And mind you, this is not a repeal and replace plan because we don't believe the federal government should be in the business of healthcare. So imagine with me a new way of doing healthcare. So, you need a little picture here. Here it is. This is healthcare. This is all of healthcare in America. The pie. Here's the wedge. A little slice of all the healthcare. And we call this the Wedge of Freedom. And in the Wedge of Freedom is a legally protected free trade zone for healthcare. It's a place where the government isn't. It's a place where there are no 132,000 pages of Medicare regulations. It's a place where there are no 20,000 pages of Obamacare regulations. Essentially, it's a place of deregulation. Can you imagine a place of deregulation? Do you know how much cost regulation adds to healthcare without actually improving anybody's health? So this is a place where there would also be no electronic health record mandate or its meaningful use regulations. It's a place of care and longer visits and listening ears. It's a place of pocketbook-friendly prices, a place where ethics are protected. It's a place where cash is always allowed and never prohibited. Some of you might not realize that Medicare now prohibits cash for anything Medicare says no to. You can't pay for. It's a place where charity is always allowed and never prohibited, and hospitals too. Isn't it amazing that we can go to Timbuktu, set up a building, bring nurses and doctors, and just start taking care of people? Right? It's simple. Or how about the fact that Blue Cross Blue Shield will actually allow you to go to Thailand or India to have your health care because it's cheaper. Why is it cheaper? Because it doesn't have all of our regulations. But why should we as Americans go to Thailand and India for our health care? Why should we do medical tourism outside America? Shouldn't we do medical tourism inside America? In the wedge, which is pocketbook friendly, patient friendly, and privacy friendly? In the wedge, private contractual relationships will exist between willing hospitals, patients, doctors, clinics, without government interference. This is a legal space, a legal zone. And as patients and doctors escape into the wedge, what happens? It starts to get bigger. More doctors come in, more patients come in, because here they know that they can pay a reasonable price for a doctor who will spend more than 8 minutes with them and actually care about them. So what this does is create competition for Obamacare and Medicare, and even Obamacare and Medicare patients can come in. So we need your financial support. We will need legal expertise, and we have already started to look at different attorneys for this. We will need marketing expertise. The wedge becomes a concept that the public can wrap their mind around, a new way of doing healthcare in America. I envision people saying, "Are you a wedge doctor? Is this a wedge hospital? Is this a place where I don't have to worry about ethics or my privacy? The prices are low, people actually care about me." I envision the Catholic hospitals coming back. They don't have all those regulations that made it difficult for them to survive. So this is a very big project. But what we're going to do is bring the heart back to healthcare. Bring the heart back to healthcare. Because this is what patient care is. Where have we gone in America with 8-minute visits and with clicking everything that you say into a computer and a scribe coming into your room and treatment protocols? Where have we gone? We need to go back to freedom in healthcare and the way that patient care should be. So our plan is to build the wedge, to build a new way of healthcare in this country, to get rid of HIPAA, which is the foundation of government control. And we would be very happy to tell the next president what he or she can do to start to get rid of Obamacare and help us break free. So remember tonight that our organization, this is a fundraiser. This is our biggest fundraiser of the entire year, and we need your support to do these things. So remember that Citizens Council for Health Freedom is a 501c3 nonprofit healthcare policy organization. I ask you to give generously. And I'm going to ask you now to every one of you, not every one of you, but somebody on the table, take that silver bag from the middle of the table and pass it around. We take check, cash, credit card, and this year we even take stock. You can call us and let us know. So I'm asking for everyone to give before you go, because this is the only way that we have the successes that we had. It's the only way we will build the wedge, not only legally, but in the minds of the American people. So, if I can have your attention for one more minute. I just want to tell you we have a delightful program tonight. It will be fun for you to meet Richard Weinstein, and you will be amazed to hear from Dan Bongino. And during that time, I hope that you will consider contributing to our organization and helping us to do what we do best, which is to fight against government healthcare and to fight for health freedom. And together with you, what can we do? We can watch Obamacare go what?
Bye-bye.
Thank you.